practice physical distancing, wear a face covering, wash your hands frequently. However, we know that many Wisconsinites do not have a choice in whether or not they can stay home, and many preventive factors are more difficult or even unattainable due to economic factors or systemic racism and other forms of oppression. I'm privileged to be able to do my job remotely, like this media briefing, for example, but we know that that's not a reality for everyone. Many of us in Wisconsin don't have that option, so it's up to all of us to make safe decisions for our community. That's why a decision tool we're sharing today is a tool that you can use when deciding on social activities. So the things that you want to do outside your house that, again, are not essential. Again, staying home is the safest thing to do, and we know that's tough and that people are tired of COVID. And because of that, because we know people are choosing to do different activities, we want you to have the tools you need to make the safest decisions that you can. And this tool is designed to walk you through questions to consider as you make decisions regarding what social activities to engage in and how to make the safest choices possible for yourself, the people you come in direct contact with, and others in your community who could also be impacted. So here's a few examples of questions that the decision tool provides. Are you or someone you live with at high risk for severe infection or becoming hospitalized from COVID-19? Will the activity take place indoors or outdoors? Will you have to share anything, food, tools, with other people? How many people will you interact with? What level of COVID-19 activity is there in your community? And if you do this activity, how could it impact other members of your community that you have contact with? Again, staying at home is the safest decision you can make. And if you're not home, you need to wear face covering and practice physical distancing. The intent of this tool is to empower you to make decisions based on how activities can impact you, your family, and your entire community. So it's our hope that your decision is to stay home, but if not, we want you to take as many precautions as possible to keep everyone safe. Next week, the creators of this tool will be hosting a Facebook Live event about how they've used it to make decisions about their own activities. We'll post it on Facebook asking for your questions, so if you've been trying to decide on any activities lately, please comment on that post, and they'll be ready to walk through using this individual decision tool to help you make those decisions. I hope you're able to tune in. So next up, I am going to introduce Tracy Desalvo. As Jennifer mentioned, she is the acting director of the Bureau of Communicable Diseases here in the Department of Health Services. And Tracy is going to talk through another announcement that we have on school guidance. Tracy?
Thank you, Stephanie, and good afternoon, everyone. Today, we released guidance on school outbreaks to help our school districts and local and tribal health departments effectively respond to cases identified among students and staff. We know that this is going to be a school year like no other, and that the COVID-19 pandemic poses significant and unique challenges when it comes to the education of Wisconsin school children. With the disease activity we are seeing, the reality is that we will see outbreaks in schools once the school year starts. That is why this guidance is so important. And it's also why continued collaboration between our school districts and health departments is integral to our guidelines. We know that this is already happening around our state, and that many districts have already consulted with their local health departments in putting together plans for the school year. We appreciate this important work and hope to further support it with these guidelines. Our guidelines cover preventative measures like physical distancing and wearing a face covering. We talk about steps districts can take to identify cases and close contacts. And we also have considerations for local health departments when it comes to contact tracing and isolation and quarantine practices for students and staff. In addition to this guidance, public health experts at DHS will work with local health departments to provide technical assistance to school districts throughout the year. It is not possible to eliminate the risk of transmitting COVID-19, but we can take steps to reduce its likelihood. We continue to follow the science of the virus just as we have throughout the pandemic response. And this guidance was informed by measures taken in countries where in-person learning has already started. This is a good time to remind us all that our actions are interconnected. and the decisions we each make about activities in our communities have an impact beyond ourselves, including on our school children, our teachers, and our school staff. As we each do our part to stop the spread, as we limit our interactions, wear face coverings, and carefully consider our activities, these actions help to stop the spread in our communities, and stopping the spread in our communities helps to stop the spread in our schools. Thank you, and we are now ready to take your questions.
Thank you. And a reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question. We do have time today for a question and a follow-up. And we'll begin this afternoon with Danny Maxwell from WKOW-TV in Madison. Danny?
Hi, I just wanted to ask a question about the school guidance. What will happen with the DHS and the school district, or between the DHS and school district, or the local public health department and the school district, if there is a spike at a certain school or in that district? Can you kind of take us through what would happen if we do see a spike at a particular school or district?
Yeah, Tracy, I will, as the resident epi here, I'll kick that one to you.
Sure. Our guidance lays out some steps that the school district, in cooperation with their local health department, and of course with technical assistance from our staff at the Division of Public Health, can do to respond to cases and a potential outbreak in a school. And that includes mitigation measures to halt the spread, things like physical distancing, increased hand washing, contact tracing, right? Something we've been talking about a lot throughout the whole of the pandemic, contact tracing, identifying those people who have been exposed and who would require quarantine. And then we also talk about places and points in time where a school might consider either having a particular classroom or cohort that might need to be sent to a virtual learning style for a little while, like temporarily moved virtually, or perhaps taking that beyond that to a whole school, just depending on the context and the spread of that outbreak. And it's really going to be something that's going to vary from school to school and district to district, and that's why our guidance really provides a set of guidelines, but isn't so prescriptive about things that you have to do in every setting.
And Danny, did you have a follow-up?
Thank you. Yeah, I was just curious. I know it may be kind of apples and oranges, comparing apples and oranges, but we are seeing some outbreaks as college campuses go back to school, not here in Wisconsin, obviously, but in some other places across the nation. And so I'm just wondering if anybody could speak to, as we get going here at UW-Madison and some of the other UW system schools, if you are working closely with the schools, if we could expect to see something like that here, and if we do, then what is the next step in that process?
Sure, I'll take a stab at that one. So yeah, I mean, I think that, one thing that I really want to emphasize in this briefing today is that I think we should be prepared in Wisconsin to see a lot of we already have pretty high community transmission. And so because we have high community transmission in this state, we can expect that there will be school outbreaks. And we can expect that while this guidance is primarily intended to assist, sort of the K-12 kind of age range, for those types of schools, certainly higher education and any, type of environment where people are gathering, we do anticipate seeing outbreaks in those settings as well. So certainly the same rules apply in terms of what we would do with any type of outbreak in any setting, which is our local public health department will reach out to those facilities and do the interviewing and the contact tracing and try to really provide that guidance that is really specific to that particular situation, because we know that there's a lot of variability, amongst different settings, and so it's really going to be important, that schools and higher education facilities, are working in conjunction and closely with local public health, and certainly the state public health can provide technical assistance as well.
Thank you, Danny. Now to Scott Bauer from the Associated Press. Scott?
Hi, thanks for doing this call again today. I wanted to talk about the testing numbers. Over the past 7 days, we've averaged about 9,400 tests performed a day, and that's 25% below the goal the governor set in the Badger Bounce Back Plan. You all talked about capacity to test, and I'm asking about the actual number of tests that are given. Why are they so low? Is there a shortage, and if so, what's being done to address that?
Yeah, I can speak to that. We know that we are hearing definite shortage of supplies. So there's a supply chain challenge with certain types of platforms, and that there is certain reagents, I guess, as certain types of supplies related to conducting the tests are in short supply across the nation, and that has been a struggle. Wisconsin is not immune to that problem. Many of our labs are operating, under several different types of testing platforms, and so we're trying to diversify as much as we can in order to keep that capacity available, in Wisconsin and in our state for our residents. But understanding, when you have health systems and others, have relied heavily, and they've instituted certain instrumentation that requires specific supplies, and those are just in high demand. So what I will say about our numbers is that that may be reflecting that those supply shortages, we're not able to necessarily have the highest capacity being conducted on a daily basis, but it could also reflect a decline in the number of individuals who are seeking testing. That is something that we encourage people to continue to seek out testing, even if you do have, if you have symptoms, and certainly if you've been exposed.
And a follow-up, Scott?
Yeah, as a follow-up, are you concerned that as schools go back and we potentially have more people getting tested, either on campuses or parents worried about children or these potential outbreaks, that our ability to test the number of people who will seek a test won't be able to meet that demand?
Yeah, I mean, it's certainly something that we're monitoring. We're actively trying to increase the capacity in Wisconsin, in light of what we're anticipating will be additional demand, right? So, as I mentioned, we're trying to sort of diversify and, get as many, different types of platforms available in Wisconsin so that we can help mitigate some of those supply shortages. But also, we know that we will probably not be in a situation in the state or nationwide, for that matter, where we're going to be able to, keep that up with that demand, just because of those where we are in terms of the supply. That said, we know that there are a lot of different types of tests that are continuously being approved, for use. There's a lot of conversation, with our healthcare partners and laboratory partners about the best kinds of tests to use for certain situations, because not all testing supplies and testing, platforms are the same. They have different, different methods, and some may be more appropriate for certain situations than others. And all those conversations continue. But certainly it is something that we're monitoring, and and we definitely are going to need to look at our framework for how we prioritize tests. Should we find ourselves in a situation where the demand is definitely, if it outruns our capacity.
Thank you, Scott. Now to Adam Rogan from the Journal-Times in Racine. Adam? Again, Adam Rogan from the Journal-Times. Okay, let's move on then to David Wahlberg from the Wisconsin State Journal. David.
Yeah, thank you. In terms of the school guidance, I'm wondering if you can be a little bit more specific about when schools might be asked to conduct classes virtually. I realize things vary by district, but most schools are in one building. So if you have one student in a building test positive, would that trigger it? Would it need to be one student with known close exposure to at least 2 others? Would it have to be at least 2 cases? What would trigger a decision to have a class, a cohort, or a school need to go virtual?
Sure, thanks for that question. We have a lot of guidelines for schools and local health departments to consider here. And as I mentioned before, we are trying to not be too prescriptive so we don't have sort of a one-size-fits-all, because we know that schools and districts can vary. But what a school and a local health department are really going to take into consideration is that one case, part of maybe a small cohort that is in a single classroom with a single teacher. They don't move around a lot. They're not going to the cafeteria for lunch. They're really sort of isolated to that small group. And, we have to look at the age of the students, their ability to appropriately physical distance from each other, right? For instance, middle school children may be able to physically distance better than kindergartners. So we have to look at the interactions that are going on in that particular class and classroom. And so in that situation where you have, a small group in a single classroom, maybe who's physically distancing appropriately, you might not have a lot of close contacts who would have to be excluded and quarantined. So there might not need to go to a virtual learning method necessarily for that whole group. But in other situations, you might need to, if you have a kindergarten class and you have, someone who's ill and lots of kids who've been potentially within 15 minutes within close contact of each other sort of during that one day, you might have that whole classroom that would need to then be going to a virtual learning style for a little while. But we really want schools and local health departments to have the flexibility to assess those things on an individual basis and to look at each situation as it arises.
Yeah, and I would just add to that, just sort of big picture, generally is what we're recommending is that, if there's a situation where, other outbreak mitigation measures, have been implemented and, and they're just not effective at halting the outbreak transmission, that certainly would be a situation where, school and district administrators should consider, temporary classroom or school, closures, those, or, dismissals, those kinds of things. Or, there could be situations where you've got in-person instruction, has been seriously impacted because there are so many staff out, or student absences, not unlike, situations that occur when we see, in winter time where we have influenza outbreaks or norovirus outbreaks. We do see some school closures that occur, similarly due to, the absenteeism or staffing issues. And sometimes, certainly with norovirus and COVID-19 would be no different, classroom or school-wide cleaning and disinfection, that would be a situation where you might consider, closing a school temporarily in order to complete that deep cleaning. And so those are some examples if that helps.
Do you have a follow-up, David?
Yeah, I guess I'm just wondering, the decision ultimately is up to the local health department, is that right? As opposed to the school district?
It's really the local health department working in coordination with that school district to make the decision that's going to be best for the students and staff at that school. Mm-hmm.
Thank you, David. Now to Marty Glazer from Spectrum News. Marty?
Yeah, my question is actually when it comes to reopening schools, when that, the time comes, or the schools that allow it, what is going to make us different than some of the other countries that have already opened their schools and have found that, one student will spread to 30-something teachers? What are we taking from those other countries? Like, why are we any different? How do we hope to navigate that if they're struggling with it currently?
Yeah, I think that's a valid question, and definitely, something that, we are definitely, looking at other countries and, sort of monitoring, lessons learned from those situations. I think that, what I'll say is that, all of that information has been taken into consideration when we're putting together the outbreak guidance that we're releasing here today. Is that, certainly we want schools, and we know that DPI has put out, education forward framework that allows, schools to open as, and to help schools decide, the type of method that they're going to reopen in, whether that's sort of the, hybrid model or in-person model or completely virtual model. That is all taken into consideration, with this guidance. We want to make sure that if it is an in-person model, that the district and local health departments have what they need in order to, make the decisions that are best for that particular situation. And so, certainly, taking into consideration all of the learning that is happening across the world, and putting that forward within the guidances. Certainly, the guidance that we have issued thus far, for every other sector, has gone under revisions as we learn more about the disease, and we would expect this to also be a fluid document based on how things are going. So,
follow up, Marty.
It's kind of not really a follow-up, but I have a question though on the decision-making tool that you guys are launching. You said there's going to be a Facebook event about that. Is that something that families can just go into and check things off as if it were, in a computer, like a lot of these kind of tracking apps that they've been that different companies are bringing about to help like companies reintroduce their employees to the workplace?
Well, what it really is to help people. It's not really intended for use to decide whether to do like necessary activities, like going to work or school or things like that. This is really, for activities that are maybe more leisure activities, or things like that. Should I go pick pumpkins in the fall? Those kinds of decisions, like how safe is that? And so what this tool is basically a list of questions that someone can go through and do an assessment about that particular scenario that they're wondering about. And it can be, whether, and we've sort of broken it down by, the home sort of questions, the nature of the activity that folks are thinking about, and then what are the community conditions that are happening within, sort of the region that where the activity is set to take place. And so all of those, it's trying to help people think about all of these different factors as you make decisions on, whether to, host that family reunion or, those kinds of things. So that's really what it's intended for. It is online, and it is online right now, and it is the website is dhs.wisconsin.gov/COVID-19/decision, and that should take you there. Otherwise, you can just go right on our COVID-19 webpage, and you'll find on our menu making safe choices or safe decisions.
Thank you,
Marty.
so much.
Thank you. Now to Brian Polson from Fox 6 in Milwaukee. Brian?
Good afternoon. Hi. I think this is probably a question for Tracy, but either one of you can obviously address it. For schools that will be holding in-person classes either full-time or on a hybrid basis, obviously mask wearing is recommended or even required, but My question is about the type of masks that DHS recommends, if there's any guidance for school staff members in particular. A couple of weeks ago, Whitefish-based schools sent guidance to staff saying that OSHA does not recommend N95 respirators in a school setting, and in fact said they would not allow voluntary use of N95s by staff, but didn't exactly explain why. Can you talk about if there are particular types of masks from a health perspective that are best for this kind of setting and why some might not be appropriate for a school setting?
Sure, I'm happy to talk about that. So we really recommend that people would continue to wear their cloth face coverings, as is being recommended in accordance with state orders and any local orders that might exist in your area. N95 respirators really work best in a healthcare setting where someone is able to be fit tested, and so are not necessarily the best thing to be using in the school setting. And we would really, like to preserve that supply of N95 respirators for the healthcare system where possible. So that's not necessarily something we would recommend that would be used in the school setting. But cloth face coverings are great. They really do a lot to help prevent and reduce the transmission of COVID-19. And so we would recommend that people continue to wear their cloth face coverings in schools and elsewhere when you're out in public.
If I could follow up on that, on the one hand, I've had it suggested that perhaps it had to do with the exhalation valves on some N95s, that we know that those can actually make the situation worse in terms of spread of the disease because they're meant to protect the wearer. But my question really is about what you said, that cloth face coverings are recommended because N95s need to be fitted. I mean, I assume cloth face coverings are not fitted to a wearer either. Is there a reason that the N95 would be inferior if it's not fitted versus a cloth mask?
Sure. So for an N95 mask to really be doing its full job of protecting the wearer, there is actually some fit testing that happens to make sure that it's fitting that wearer appropriately. And for a cloth face covering, you just want to make sure it's really covering your mouth and your nose, and we're reducing the spread of droplet particles into the air when you're talking, if you cough or sneeze. So a cloth face covering in this situation really is a great thing for everyone to be wearing.
Thank you, Brian. Now to Jessica Van Egren from Up North News. Jessica.
Yes, thanks for having this call. My question has to do with one of the points on the dashboard. For the past week and a half or 2 weeks, one of the dots has remained red, and it's the one that has the downward trend of COVID-19 cases among healthcare workers. I was wondering if this was something that's calculated weekly, and if you can talk a little bit what's going on with, that population, the healthcare workers and COVID.
Yeah, I'd say we are seeing a downward trend in sorry. I think I have could you repeat the question? It's the red dot. Sure.
Yeah, the red dot, I believe for the past week and a half or two has been, staying the same for the indicating that I'm assuming that the healthcare workers experiencing COVID is not going down. That's the way that I'm reading it. But I could be wrong, and that's what I wanted to ask about, since that dot is remaining the same.
Yeah, I mean, the red dot would indicate that we are not seeing a downward trend. So sorry about that, I misspoke. And I think that is probably, largely due to the fact that we continue to see high levels of COVID-19 disease spread in the state of Wisconsin. So we would expect, that most, that a lot of employers are going to continue to see positive cases within the various industries in Wisconsin, and the healthcare industry is no different. So I don't think that there's anything in particular with the healthcare worker situation that we would point to other than we are seeing high levels of community spread, and disease activity is unfortunately continues to be high in Wisconsin.
And Stephanie, I'll just add that for that specific measure, we're actually looking for a significant downward trend over the course of 4 weeks. So if you're looking at the data below, you can see that the preliminary data the last couple weeks, it does look like maybe we're starting to see a little bit of downward movement among healthcare workers, which is a good sign. But we're really looking for that statistically significant downward trend over the course of 4 weeks before that gating criteria will turn back to green.
Do you have a follow-up, Jessica?
No, that's good for now. That answers my question. Thank you.
Thank you. Moving on then to Michelle from NBC 15 in Madison. Michelle?
Hi, I'm just learning about traces of COVID-19 in mink. So can you tell me what you know about that and then what you recommend for mink farmers in our state?
Yeah, Tracy, I think that might be better suited for you.
Yeah, so we know that there is some evidence that COVID-19 can be transmitted from humans to some animals, and mink are one of those animals. And so we continue to recommend that, you know, people, when dealing with their pets, if you're a person who has COVID-19, that you would be just conscious when you're around your pets. And the same thing would go for mink farmers. So wearing a mask or a face covering would be a good thing for those individuals to be doing, and just having good hygiene practices on your farm to continue to reduce the spread.
Follow up, Michelle?
Can I ask a follow-up? Yes. Would you recommend that the Department of Agriculture institute a kind of reporting requirement for mink farmers?
So if a mink farmer was someone who was positive for COVID-19, of course, their case would be reportable to public health, just like any other case of COVID-19. And of course, we do have resources both at the Department of Health Services and the Department of Agriculture, Trade, and Consumer Protection, who are available to help farmers who may need additional assistance or guidance related to COVID-19. So we're happy to connect anyone with those resources if they're needed.
Thank you, Michelle. Now to Heather Foster from WSAW-TV in Wausau. Heather.
Hi, this is actually Emerson filling in for Heather. My question is, what is the threshold as a state that we need to hit before it can be said that the mask mandate is having a positive impact on the number of positive tests that we've been seeing?
Yeah, it's a really good question, and I don't know that we've not established a threshold as much as it is, we know that we have, very, high community spread in Wisconsin, and the idea is to not be high community spread, and so, I think that we've really looked closely at our, disease, burden and the trajectory. So really that is, how many cases we have and whether or not, we're seeing a trend that is going in the wrong direction, which would be increasing. And so we I really think that we would continue to monitor those trends and to understand, whether the mandate is having an impact. And so far, we are definitely, if you look at our, epi curve here, we are seeing, some decreasing activity, but it is, probably a little too soon to say with any certainty, about what effect the mandate has had so far.
And do you have a follow-up, Emerson?
Yes. So a few of the counties in central Wisconsin, they've started implementing the online portals where residents can report mask violations in the area. Have those, to your knowledge, proven to be effective at this time?
So I think that it really is going to vary depending on, the level of, each local health department or county, it may be handling that differently. So we don't have anything like that statewide, again, because the enforcement is done at the local level. And so, I I would not be able to comment on, how effective they have been overall, but certainly, we know and we have heard, anecdotes of situations where, there have been complaints and those have been followed up on and the appropriate actions have been taken, and folks have understood, what they need to do to sort of come into compliance. And so, all I have is sort of anecdotal evidence there, but, I think certainly, in order to help streamline some of those complaints, that the online tools, have certainly helped with the workload at the local level and really giving the public a place to go to lodge, concerns that they may have.
Thank you, Emerson. Now to Stephanie Hoff from WIS Politics. Stephanie.
Thanks for holding the call and taking my comments. Is the state doing pool testing, and are you planning to do pool testing?
To my knowledge, at this point, we don't have any labs in the state of Wisconsin that are doing pooled COVID-19 testing. And certainly it's up to each laboratory to make a decision about whether they want to pursue FDA approval to do that kind of testing within their laboratory, but nothing at this time to our knowledge.
And a follow-up, Stephanie?
Yeah, am I unmuted?
Yep.
Oh, okay. Yes, so how are you is the state trying to diversify testing to kind of ease the stress on the supply chain?
Yeah, it's a great question. So we are, we have had many different conversations with labs across Wisconsin, as well as, in some other parts of the country to help us really bring some capacity, additional capacity that we know we're going to need here in the fall. And so, we are, we have I believe, procured some additional, tests for the state. That we're not talking, big numbers here, but definitely trying to make sure that we have lots of different labs that can help us, provide as much capacity as we can for the state. Again, there's lots of conversations about different testing types, and so what we're really talking about is continuing to use the PCR test, to do that testing. It really has been, sort of the standard, and so that's really what we've been focused on at this point. But we also know that there's other types of tests, that are coming onto the market and are, becoming available. And I think that's what I was talking about earlier, is that we need to figure out, the best use for these different types of tests that are coming onto the market and how they can complement the strategy that we already have in place, with the PCR tests. Is there anything you would add, Tracy?
Nope, I think that's great, Stephanie.
Thank you, Stephanie. And now to Jonathan Nizer from NBC 26 in Green Bay. Jonathan.
Yes. I am wondering if there's a way to project if there's any chance of Wisconsin successfully getting all of those gating criterias back to green before a vaccine is developed, or are we destined to struggle with one or two of these categories until that happens?
That's a really good question. I think that, obviously that's the goal, right? We want to, make sure that we're getting, Wisconsin back to a place where, we have low disease activity, across the state. I would say that, we have pretty limited tools, within Wisconsin to be able to mitigate this. And because we already have, pretty high disease spread in our state, I think we can anticipate that we will see, continue to see outbreaks in workplaces and in schools. And, I would say that we're going to, try to do the best that we can, which is why, we've instituted, one of the tools, which is the face covering mandate, to try to have these numbers, decrease as much as possible. I think, the fact that we don't have a vaccine right now, we have very limited tools in our toolbox, which is why we continue to stress the importance of people physically distancing, wearing face coverings, and making sure that they're making the best choices that they can, whether that's staying home or having very different types of visits with their friends and families than maybe they're used to. These are things that we have to sort of band together and try to really practice in order to ensure that we're seeing those case numbers go down. And until we have a vaccine, I think we are going to have to sort of muddle through these inconvenient and in some ways kind of annoying and very hard decisions and hard it is not easy for anybody right now, and I think having a vaccine is going to be helpful, but I think we can also anticipate that once, a vaccine is not going to be widely available once it is approved and, ready for distribution. I think that there will be some supply chain, challenges, and they're not going to be able to roll out vaccine, as much as the demand would need right away. So, that's what I'm sort of anticipating seeing, but it's a good question. And I think, it's hard to sort of think, people are tired, and it's difficult to continue to think that we are going to have to live, in this sort of weird spot that we have been, since March.
Follow up, Jonathan?
Yes, there's been some other questions related to diversifying testing, but I didn't hear anything specific to this, so hopefully you can shed a little light. Recently, they talked about these saliva-based tests being available for the first time. The FDA just approved them, it sounded like. Are those going to be part of the mix, or are they already part of the mix? And what does that do for our kind of supply chain issues?
Mm-hmm. Sure. So as you mentioned, there are some tests where saliva is actually an approved specimen type that are coming onto the market. And of course, some laboratories are now running those tests, and it's important that laboratories are following package inserts and running tests according to the specific guidelines for those tests. But we do anticipate that those kinds of tests and others are going to continue to become more widely available, as nationally we're working to diversify the availability and types of testing platforms that are available to laboratories.
And what I will say about that in Wisconsin is that, because that just, sort of came on board, that's not something that we are, actively pursuing right now. But certainly, again, as more of these different tests and testing capabilities come online, we have to look at, a lot of different types of tests and try to figure out which ones, make the most sense for the Wisconsin strategy that we're, trying to ensure that we have as much capacity as possible. So more to come there. I think, it's an evolving thing. We hear about new news in the laboratory world pretty much every day. And so, it's definitely quickly moving, and we do have, great team of laboratory partners who, we work with very closely to have these discussions and try to figure out, who has what capacity to run what, types of tests and who's interested in pursuing, certain technologies and things like that. So, yeah.
Thank you, Jonathan. Now to Suzanne Vitale, a freelance journalist. Suzanne.
Good
Good afternoon. What is likely to happen when the mask order expires at the end of September? Can it be renewed? And what would be the criteria for renewal?
It's a good question. And I'm afraid that I don't have the answer to that. So we might have to follow up on that particular question. Yeah, sorry, I don't have that.
Sure, and we can assist you with that, Susanna. Do you have a follow-up question or an additional question?
Sure. Actually, I also cover Minnesota, and Minnesota just reported its 17th case of multisystem inflammatory syndrome in children. Can you give us an update on cases in Wisconsin?
Yep, it'll take us just a second to pull that up.
Okay.
Okay, my apologies. I could not then find the unmute button. So yeah, it looks like we have 9 cases of MIS-C that have been confirmed by the CDC. And that is as of a couple of days ago.
Thank you, Suzanne. Now to Scott Gerard from the Cap Times. Scott.
Hi there. Thank you. Hi there. Thank you. I was wondering, do you expect the state to create any database or anything to track outbreaks at school as the school year begins?
Yes, actually, we do have already have a facility investigation page that we have posted on our COVID-19 webpage that has sort of all of our data there, and we will we do anticipate breaking out a new category as necessary to be able to track school and higher education and daycare outbreaks. So that is something that we plan to do, and hopefully we'll be able to do that shortly.
Follow up, Scott.
Yeah, thank you for that answer. And then I was just wondering, how long has this school guidance that was released today been sort of in process for being created, and any thoughts on just the timing of its release so close to the school year?
Tracy, you want to do that or you want me to?
It doesn't matter.
Okay, I'll take a stab. So it has been in the works for quite some time. I will say it is difficult to pull all of the information together and ensure that that it is evidence-based. We want to make sure it's based in the latest science, and as you know, a lot of those recommendations change over time. We have been getting real close to having this be released for a little bit now, and we're thankful to be able to release it here today, so that schools have what they need in order to respond accordingly. So is there anything you would add to that, Tracy? Okay.
Thank you, Scott. Now to Madeline Fox from Wisconsin Public Radio. Madeline? Again, Madeline Fox from Wisconsin Public Radio. Are you there, Madeline? If not, we'll move on to Mattson from WISN. Oh, sorry. Go ahead.
Sure. I am so sorry. I unmuted on the call and then not on my home phone. So anyway, I was wondering if there's going to be, one of the things that epidemiologists and public health officials have emphasized is that people should really consider getting their flu shots this year, even more than in previous years. Is there going to be a statewide effort to push that harder, or to try to get it particularly in schools?
Yeah, so certainly we know that this is going to be a challenging fall, from the standpoint of having, influenza is always a challenge for us, each fall. And now we have this complicating factor where we have COVID-19 and, symptoms are very similar. So certainly we would like to encourage people when possible to get a flu shot and to be able to mitigate the effects of seasonal influenza on our communities as much as possible, understanding that is a tool that we have available to stop the spread of that disease. We want to really make sure that folks are doing everything that they can to stop respiratory diseases. What I will also say, though, is that the same mitigation measures that we have in place for COVID-19 are largely based off of what we would recommend for a pandemic influenza. So your same recommendations with the face covering, the social, the physical distancing, that's really going to help, with the slowing the transmission of influenza as well. So, the combination of those, non-medical, sort of interventions, as well as, influenza vaccine, we're hoping that we have a pretty sort of low incidence influenza season as well.
And a follow-up, Madeline.
Yes. At the same time, with some people putting off, in particular, non-essential medical visits and maybe not spending as much time in grocery stores and pharmacies and the like, are you worried about a downward trend in people who are likely to get those vaccines?
Yeah, I think it's definitely a concern, and it is something that we're working closely with our healthcare partners and our local public health departments to try to ensure that access to influenza vaccine is available, and understanding that may be a challenge this year because of what you already mentioned, in that people are choosing to they're not able to go out and about and to get those interventions or that shot. But I think what we would want to encourage is that those are types of essential trips that we would want to ensure that people are taking in order to protect themselves from influenza, which is also can be a very serious disease.
Thank you, Madeline. Now to Matt Sin from WISN TV in Milwaukee. Matt.
Hi. I'm curious, was there ever a thought or any kind of plan or discussion to try to test all public school students?
So I will kick this one off, and then Tracy, I don't know if you'll have anything to add to it. But again, I think given the capacity that we have in Wisconsin, that is not something that we have been recommending. Number one, and the second piece is that is generally not the CDC recommendation either, which is we would not recommend testing large because it is not something that we have the capacity to do, and may not result in actionable public health activity. So Tracy, I don't know if you have more to say about that.
Sure, Stephanie. I think the key here is that what we really want to encourage is for people who have symptoms of COVID-19 to get a test, contact your healthcare provider, or go to a community testing site and get a test. And also people who have a known exposure. Those are also people who really should be working with their healthcare provider or visiting one of those community sites to get tested. And that's where we're really going to see the most public health value in terms of reducing additional spread of COVID-19.
Follow up, Matt.
Yeah, and last thing, these guidelines for schools, these are here on the website, and they came out today under the schools and child care tip. Is that it? The K through 12 schools? Is that what I'm looking at here?
Yep, that's correct.
Okay, and those came out just today. Is that right?
Yep, those came out just today.
Okay. All right. Thank you very much.
You're welcome.
Thank you. Thank you, Matt. Now to WISC News 3 Now in Madison. WISC? Again, WISC TV in Madison. Okay, we're going to go back to Adam Rogan from the Journal-Times in Racine. Adam, are you there? Okay, with that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good afternoon.